This would represent as much as an average of 4.7% level of dehydration per wrestler, which is considered serious dehydration. Furthermore, 4.7% is the mean value. Consequently, some wrestlers were more seriously dehydrated. The subjects who lost more than 7 kilograms or multiple patients had a loss of more than 8.6 of his body weight during those 4 cycles, putting him at severe risk for heart-related illness. Subjects' self-reported caloric intake also sharply decreased during the last 48 hours before weigh-in. The average intake for Thursday was 1,526 and 900 kcals on Friday. The average intake on Saturday post-weigh-in was 3,722 kcals. The average self-reported daily caloric intake, 2,192 kcals, is below the estimated daily caloric requirements, 3,140 kcals, but is similar to the values reported by others for collegiate wrestlers engaging in cutting weight. An energy deficit of 1,000 kcals is expected to result in a weight loss of slightly less than 1 kilogram per week. However, accumulating weight loss did not occur in these subjects over the course of the season. In fact, weight fluctuations, loss, and subsequent regain remain surprisingly steady from one cycle to another. Individuals cannot consume calories substantially below their estimated requirements without adverse effects on body weight and composition. However, body composition over the course of the season did not appear to be undesirably affected. In fact, FFM increased slightly in this study. One possible explanation that there is be as much as 35 through 40% margin of error in self-reported foods recorded even with proper training and motivated subjects. Another explanation is that the WC lowers the BMR and increases food efficiency. Horsell and Melvin measured a 17% decrease in BMR in collegiate wrestlers who lost weight during the season. The depressed BMR may be an adaptive process to conserve energy by decreasing protein metabolism. Steen found that a 14% lower mean BMR in wrestlers who cycled their weight. Consequently, energy requirements during the season may be lower than formulas predicted, and this effect appears to be greatest in those who are well below their natural weight or who cycle their weight frequently. The decrease in BMR may depend on changes in body composition, the amount of weight loss, and the effects of acute dehydration. Both the amount of weight loss per cycle and the number of cycles were similar to what was commonly reported by other investigators. It appears that most subjects functioned at a minimal level of dehydration at baseline and accomplished further weight loss by rapidly through dehydration. This practice of achieving rapid weight loss through dehydration may have minimized the impact on lean body mass. BMR was not measured in this study. However, if BMR does decline, energy expenditures would be overestimated. Likewise, energy expenditures independent of training sessions, that is, during the rest of the day, may reduce during weight loss cycles, which would also reduce the total energy expenditure below the predicted values. The variations in weight loss that occur during each cycle and the caloric and fluid intakes are more easily studied when averages are compared, but this may obscure some observations. The mean caloric intake was approximately 950 kcals below the estimated energy needs, but individually caloric intakes range from 0 to 6,130 kcals. Some wrestlers maintained their weight close to their target, whereas others accomplished a more dramatic weight loss each cycle to make weight. Furthermore, the subsequently lower caloric and fluid intakes are limited to a short period, typically 48 hours, suggesting that fluid loss, as opposed to FFM, accounts for the weight change.